Hi, everybody. Welcome to the College of Health Research Family Week session and presentation. I'm going to give just a couple more seconds as people join here before we get going, but I wanted to welcome you all and mention that there will be a Q&A opportunity if you use the Q&A function of Zoom, and we'll collect those questions and then try and answer them as we go along or at the end. Okay, so we'll get going now. Again, welcome to the Q&A, the College of Health Research presentation for Family Week. I'm really pleased to be joined here by my colleague, Heather Messina, who's the Senior Contracts and Grants Specialist in the College of Health, a recent addition to our research administration infrastructure. In fact, she is our research administration infrastructure. So we're really pleased to have her. My name is Hal Skinner. I'm the Associate Dean for Research and an Associate Professor in the College of Health. I will just give a brief overview, a very brief overview of what we're going to be covering in this session today. First, a very brief introduction to the College of Health and the ideas of population health, in case you haven't heard it before. And I'm just looking at the participant list and I recognize some names. So some of you have heard this quite a few times before, bear with us. It's new for some folks. We'll talk a little bit about College of Health research resources that are available and that will be available going forward to support research. And then we'll talk about faculty current and ongoing and future research interests. And the idea is to give an introduction of what we're up to, what we hope to be up to in the future, look at opportunities for student involvement in research, collaborative research, and just getting things done around health at Lehigh University. So the first thing to know, if you don't know it already, is the College of Health has a focus on population health. Population health is a new, evolving and emerging convergent science that combines a broad range of disciplines that have fallen under various headings before, but include things like epidemiology, biostatistics, environmental health, psychology, sociology, engineering, health economics, political science, really a whole range of things that are needed to understand the big picture of what determines health in the population, what influences health outcomes in the population, and then perhaps more importantly, how we can think about influencing or changing those health outcomes for the better in the future. So this list is by no means exhaustive. For the College of Health at Lehigh University, underscoring this broad range of interdisciplinary topics is really this focus or this theme of health innovation and technology. That is, we want to take the insights that we develop from research, think about them, and then figure out ways to design interventions to help impact the health of the population in positive ways. So that's an important background so that when I start talking about these research resources, they'll sort of make more sense about what we're trying to do and what we're trying to accomplish here at Lehigh. So this is our section on research resources. These are things that are in the works, in the planning. The College of Health is now, well, we had our first cohort of students start in August. Some of us have been on campus. The dean started January of last year. I started in July of last year. We've had other faculty joining us in January or February this year, some as recently as August. So as people come on board and we start to develop our own research programs and collaborative research programs, we're also working towards developing some broader resources that'll be valuable across the campus and to the community as a whole. And one of these is the exciting health science and technology building. Will be the new home of the College of Health and an interdisciplinary research space where the hope is that we have these happenstance collisions with people from a broad range of disciplines that lead to intellectual activity and great research productivity. And I also understand that there's going to be a coffee shop. So that's an important thing. That'll be coming online towards the end of next year, 2021. And it's a research space, it's a working space. So to the extent that students will be there working alongside faculty in experiential learning and research projects, it's a space of learning as well, but it doesn't include classroom space. The idea for the HST building and its home for the College of Health is to drive innovation in health and healthcare. Through, again, these collaborative spaces, open concept laboratories, and an interactive work environment. Within the college, within the HST, the College of Health envisions several resources that are in planning, and I'll go into a little bit more detail about each of these in turn. They include the Population Health Data Warehouse, the Artificial Intelligence and Data Visualization Lab, Survey Research and Design Thinking Labs, the Community Partnership Engagement Space, and again, quite a bit of open plan, wet and dry lab bench space. So these all have, to me, very exciting titles. I think it's helpful to know what we mean when we talk about something like an artificial intelligence and data visualization lab. So this is a physical space, but it's also a programmatic idea or a programmatic space. This will be a technology showcase, bringing forth really the latest gadgets and inventions that we can use for understanding and explaining and exploring data out of the lab space forward to the users. The users in this case may be faculty, they may be student researchers, they may be collaborators or colleagues outside of the university. But in addition to this physical space that'll be outfitted with the latest technology, we want to have instructional and consultative services. So there's a lot out there available for use in dealing with large quantities of data, big data, and data science in the artificial intelligence space. We really want to be able to demystify that and bring it forward sort of out of the back pocket of the computer scientists and onto the desktop of data analysts and population health researchers. So this includes things like natural language processing, which is incredibly useful for dealing with unstructured text that you might find in an electronic medical record or in public policy documents or other things, and turning that into structured and analyzable information that we can use in our sort of data science. But right now, to get a study going using natural language processing, if you're not familiar with it, can be daunting or prohibitively high learning curve. So we want to bring that technology, again, forward to the community of researchers and make it available for a broader range of use. The Survey Research Laboratory has a similar mission to lower the bar for mounting high quality surveys in the community to collect the information that we need to do the type of studies that are necessary for understanding multiple determinants of health in the population. A design thinking laboratory is not something that you'll find in many, well, I can't think of one that you would find in a population health or public health space. But design thinking is an empathy-driven process for innovation, for finding solutions to problems that will be relevant to the people who are experiencing those problems. And all of our students in the College of Health will have exposure to courses in design thinking, and it's a process that we want to infuse in our problem-solving skills across the College of Health, but across the university more broadly. And it's helpful in this sort of collaborative interdisciplinary approach to have a space that facilitates those types of interactions. And so this can be either a purpose design space, but I think it may end up being part of a multi-use space in the Health Science and Technology building. And finally, really as a testament to the commitment that the College of Health has in its research space to working with and for the community, there is a substantial space dedicated to a community partnership and engagement. This is a beautiful open forum space where we can have stakeholders from the community members come in, engage in and work with LEHIGH investigators and students in the spirit of community-based participatory research, bringing the community to campus and having the campus go to the community to really address the needs of the community in a substantive way and not in sort of a top-down or paternalistic way, which is, has been a traditional but criticized approach to research in communities. And finally, in terms of our research resources, we're going to be, we are planning and we're going to mounting a cohort study in the Lehigh Valley. And so to really, I want to explain sort of what a cohort study is, to talk about you know, why this is important for the College of Health and for our research needs. And this is really going to be a resource that's not aimed at one particular faculty member's research interests, but more of a central resource that a broad range of faculty members and partners and students can use to develop new ideas to investigate multiple determinants of health in the population and really to develop the evidence base needed for developing new interventions to improve the health of the population. So I'm going to put up this diagram, and it's this is really, it's kind of technical. It's a really high quality graphic, and I don't want you to be overwhelmed by it when I put it up here. So, but this is how I'm going to explain what a cohort study is. And this was done by a professional graphic designer, a consultant that was paid. Okay, I did this myself with Microsoft Paint. But the idea behind a cohort study is that you enroll a population of folks on the left. These are our participants. And then you observe what happens to them in life if they're exposed to different things. Let's say they're exposed to a particular set of allergens or environmental toxins. And you can categorize their exposure as being exposed or not exposed. And then those groups, we can follow forward through time and see what happens to them in terms of their health outcomes. In this case, the health outcome is that they might turn green or they might not turn green. But then we compare those groups of exposed and exposed people over time. And this can, using appropriate methodologic and statistical techniques, we can use this in place of a clinical trial to make inferences about the causes or determinants of health in the population. But it really requires that you have a really well-constituted cohort, a really solid sampling design and follow-up, and a sort of rigorous methodology. The benefit for doing this kind of work, though, up front, is that we can collect huge amounts of information about people, including biological samples, links to their health records, links to, again, we can go back to our survey methodology and collect information from them directly, and follow groups forward through time for all kinds of different health outcomes. So it's really a multi-purpose approach to health innovation and technology. There are many cohort studies out there. You may have heard of the Framingham Heart Study, the Nurses Health Study, MESA. Eric, if you're, if you are sort of an epidemiology nerd like me, you know all of these studies, and they're incredibly valuable sources of information for scientific discovery and for advancing the health of the population. And these are really investments in research that Lehigh will make to have big dividends down the future, both for the scientific community at Lehigh, but then also for the benefit of the population. So that was sort of an overview of the research infrastructure and resources that the College of Health aims to have. On top of that, we have our fantastic research administration team of Heather, and who will be helping us to seek out funding and resources and everything we need to make sure that we have solid collaborations and support for the research going forward. And beyond that, then we have faculty's own research interests that they will be carrying forward through time. And so let me give you a brief introduction to the faculty and staff. I'll also introduce you to the rest of the College of Health team if you haven't met them yet. On the left side of the screen, we have our inaugural dean and Professor Whitney Witt. We have our executive assistant, Jeannie Casas. We have Sherry Buss, the Director of Administration. And there you can see a picture of Heather. just for validation purposes that we're not pulling a fast one on you and substituting someone in the panel here. Again, I'm Hal Skinner. I'm at the top of the screen there for no particular reason. And then my colleagues down the right side of the screen, I have to move this thing here so I can see who they are. So we have Daley, Fathima Wakeel, Ed Gomez, Tom McAndrew, and Hyunok Choi, and Sean Daley at the bottom of the screen. I had to make sure I saw him there. So I'm just going to go briefly over each person's research areas. My hope is that if you're a student here at Lehigh or have a research interest yourself, that you'd feel free to jump over to our website and look them up and reach out to them about your interests in researching with them or asking them questions about their research. They love that. I love that. And so please feel free to do that. And then, and these are in no particular order, except to say that I put Tom McAndrew first because I think he's on listening, and I want to make sure that he knows that I did cover his topic and didn't forget him. So and he might need to go feed the dogs, and he can rest easy that he's been covered here. So Tom is a computational scientist. You may call him a biostatistician, but only do so with kindness. Tom's area of interest is really in predictive models of influenza-like illness. He does predictive models of COVID-19. His approach has really been innovative. In the past, he's been doing adaptive ensemble algorithms for forecasting. That is the compilation of multiple different types of algorithms to come up with a single forecast answer at the end. And more recently, he's been incorporating human judgment data into predictive models. That is, asking people who know what they're talking about what they think is going to happen after having looked at the outcome of these models. And it's really interesting work. I'll mention Tom was just told that he was awarded a really nice Midas grant for carrying his work forward. And as a new member of the faculty, and we're really excited for him to continue that work. Outside of the research realm, Tom also is developing and teaching our really innovative approach to population health data science. It's a hybrid of traditional statistical learning and innovative programming and data science techniques that I think our students, if they haven't started doing it, are really going to enjoy. Or they will look back on fondly after they're done with the programming part, if they're not into the programming stuff. I don't want to make predictions. So second up, we have Professor Christine Daley. Chris is a professor in the College of Health. She is also one of the, or will be, they're working towards developing an Institute for Indigenous Studies, and she will be one of the co-directors of the Institute for Indigenous Studies. Chris is an applied medical anthropologist. Her work aims to reduce health disparities in American Indian communities. She's been doing really important and innovative work using mixed methods. That's the combination of qualitative and quantitative studies and community-based participatory research approaches, which is extremely important for developing the kind of culturally tailored programs that she has for smoking cessation. This is really a great example of translating information from research insight into impact. That is, taking what she has learned about the communities and cultural needs for smoking cessation, turning it into an intervention that will work for a particular community. And more recently, her work has picked up into understanding the COVID-19 pandemic in Native America. This will be a theme in faculty research, working in the population health area, working in epidemiology. We have general methods. We are able to pivot and address important health concerns as they arise. And certainly COVID-19 is a very important health concern that has recently arisen. So next we have Professor Sean Daley. It's no coincidence that he shares the same last name as Professor Chris Daley. They're a married couple. Professor Sean Daley is an applied sociocultural anthropologist and ethnographer. Sean will also be one of the co-directors of the new Institute for Indigenous Studies that's in the works. His work focuses on contemporary American Indian health and education disparities. In his approach is more participant observation, although certainly within the community-based participatory research framework. And he also adopts an approach of activist scholarship to make sure that his work is having an impact in the community. He does also a lot of work in Native law and policy, identity, spirituality, and he does quite a bit more than this, but you can only fit so much on a slide with a reasonable size font. So I encourage you to contact both Professors Daley with additional information about their interests. I would say another important aspect of the work that the Professors Daley have been doing is that they have created an educational pipeline to bring community members from the Native American community into the research space. So essentially training scientists who will then be able to go back to the communities and carry out the kind of research that needs to happen to improve the health of their own communities. And so this is a fantastic example of combining research and education in a way that it makes a difference for the population. So next up is Professor Fathima Wakeel. Professor Wakeel is an associate professor in the College of Health. She's a maternal and child health researcher. She's also the director of our graduate programs. Professor Wakeel uses a life course approach. And I will say I'm an epidemiologist, so I might tend to frame things as epidemiology when I talk about them. So be aware that I have that lens. So I would consider her a life course epidemiologist. She looks at the determinants of health all the way from preconception things that might happen to a mother before she's even pregnant that could influence the health of her child in later years. She really aims to reduce disparities in adverse maternal and child health outcomes. And a key area of her research is looking at factors that protect against adverse health outcomes for women and children. She's conceptualized this as personal capital. It's related to concepts of resilience that you might hear people working on. She has two current studies and a range of other interests. One of them is a cross-campus multi-phase study of the needs of Lehigh Valley communities during the COVID-19 pandemic. She stood this study up and attracted a huge range of collaborators from across the campus in a matter of days, it seemed like. It's going extremely well. They're getting very valuable information about what's happening in the Lehigh Valley. And I can't wait to see the results that come out of that. She's also got a 3-year funded study from the Pennsylvania Department of Health looking at how past stress and personal capital relates to women of reproductive age in South Bethlehem. And this is a really cool study because she's taking a culturally tailored approach, community-based participatory research, to develop an instrument for measuring personal capital or resilience that's relevant to the people that live in the local area. So rather than taking something that someone else developed in another time and place and trying to use it here in the Lehigh Valley in South Bethlehem, she's developing the tools from the ground up, and we'll do the evaluation component of that. It's really interesting science. So that's Professor Wakeel's work. And then Professor Choi is an environmental epidemiologist. The richness and excitement about her work is not at all proportional to the number of bullet points here. Professor Choi does really groundbreaking, cutting edge work, early life environmental exposures as they relate to asthma. But she takes a multi-omic approach. I was supposed to describe, I say it's a systems biology approach to population health, but she would prefer that I describe it as an exposome approach to systems biology and environmental health. And the exposome is like the idea of the genome. So whereas in the genome, we look at all of the genes and all of the variants across the entire genome at one shot and try and make sense of it, the exposome is looking at the full spectrum of possible environmental, biological, sociocultural exposures that can happen to an individual, and trying to distill that down to some essential mechanisms that influence health. And so if you're interested in tackling big, thorny analytic methodologic problems with lots of information, Professor Choi is someone that you might want to talk to about learning how to do that. Professor Gomez, Ed is a political scientist. I feel like I can't mention Professor Gomez being a political scientist without mentioning that his hobby is Brazilian Jiu-Jitsu. Unfortunately, because of COVID restrictions, there's no capacity to practice that right now, but I think he's hoping to start a club and training on campus for that down the road. Completely unrelated to research, I'm sorry, but I digress. His area is the politics and commercial determinants of health. So he has looked at how various competing organizations like Coca-Cola might interface with a government to lobby and influence legislators, whereas other organizations might be trying to lobby for health-related policies that would mitigate the effects of sugar-sweetened beverages, and how corporate entities also interface with non-governmental organizations in other health spaces. It's a very interesting web of influence that happens in international politics related to non-communicable diseases. Professor Gomez works internationally. He works extensively in Latin America and Brazil, and does a lot of comparative work between the US and Latin America. And like the rest of us, he's also turned some of his attention towards COVID-19 politics and policy in the United States. I hope you're getting the picture as you look at the range of topics and the range of disciplines that we have in the College of Health now. In the first year of what we're aiming for in this idea of convergent science, that we work together across a broad range of disciplines. We stretch ourselves to understand each other's work and methods so that we can address these problems in new and unique ways. And finally, I mention this only because I have to, and I'm here. I'm a molecular epidemiologist. I have jokes about this that I'll save for later in classes. If I use them up too quickly, I run out. My interest is primarily in the biological determinants of disease. I did most of my work my early academic career around cancer, looking at the genetic and molecular determinants of pancreatic cancer. I did quite a bit of work trying to develop novel diagnostic and prognostic models for ovarian and prostate cancer, and translate that work into meaningful diagnostic tools. And so one of those is now in evaluation for commercialization. Hopefully it'll become available to women as a diagnostic for ovarian cancer. The other area I worked in is what I think I'm now calling population health technology, because I don't know a better way to categorize it. So for 5 years, I worked for IBM Watson Health and the company that it acquired, Proven Health Analytics, doing a range of different things in the commercial space. One of them was evaluating IBM's artificial intelligence-based decision support tools in oncology practice, and that is a tool based on artificial intelligence that was designed in Manhattan with Memorial Sloan Kettering. How well does that work when you take it to a cancer hospital in Shanghai? How well does it work when you take it to a general hospital in a smaller city in China with general oncologists? I did a lot of work around health and healthcare quality measurement that plays into the important topics of value-based care and purchasing in healthcare, and some more nitpicky methodologic work around the idea of harm-based weighting for patient safety measures. If you think you might be interested in that, reach out, we can have a conversation, but I don't want to bore a larger group with things like PSI 90. And finally, more broadly, the idea of how do we use big data in a meaningful way to make the kinds of valid causal inferences that we like to do in epidemiology and population health. So there are methods that we need to work on to make this feasible. And it's by no means trying to put statisticians out of business, but they do get a little defensive sometimes about it. And then finally, I'm really interested in, again, more broadly, these methods for causal inference, and whatever comes up. So, you know, we had to do some work around COVID-19, whatever needs to be done for the health of the population. I like to be sort of a rapid responder if we need that. So that's the faculty that we have. Last year at this time, we had one faculty member, that was me. Now we've got six, I can't count, public display, but let me just say where we're going. We're growing. And so in the next year, we hope to grow by 9 more faculty. Priority areas, right now we have an open search for biostatistician to join Tom in that field because we have a lot of classes to teach, a lot of work to do, and Tom can't do it by himself. We have an open position for health services researcher or health economist. And just recently we got the okay to go ahead with the Ellen and Vincent Forlenza 1975 Chair in Health Innovation and Technology. This will be the first, this will be the anchor for the first Department of Health Innovation and Technology in the world. We're really excited about that. We are really open to big ideas and what this can mean and who we can get to fill this position. And then we're going to have more, and it's going to be more this year, and it'll be more next year. So the areas and the topics that you see today will be different next year at this time. But again, we're going to continue this process of convergent science, of bringing ideas and people and disciplines together, sometimes with like extra encouragement and intensity for working a little harder or a little closer than people might be comfortable with. We want to push our comfort levels to make this work in a new and exciting way. And that went faster than I was expecting it to, but I was talking a little bit fast. So I'm happy to say thank you to everybody for showing up. I want to take any questions that you might have. There's one question in the Q&A, and is at what year can you begin working on research with professors? And I would say you can, I've had people in contact with me from the 3rd week of their first year to ask about doing research with me, and I'm open to it, but you have to recognize also that you know, as you go through the program, you develop additional capabilities which will you know, sort of expand your horizons and what you can accomplish in research. So at the very beginning, we can do some work around you know, forming research questions, developing literature reviews, but you know, when you know how to do an artificial neural network, a random forest algorithm, you know, in just a year and a half, then you're going to be capable of doing much more and contributing much more to the research programs. So I love it. I want students to be excited. I want them to get involved, and I want them to bring their A game and what they're learning in the Pop Health program to get that experiential education. So if someone's got a hand up, go ahead and ask a question if you want to, or put it into chat Q&A. I don't know if we can unmute people. No, I just saw it. The hand was up, hand is gone. Okay. So Jessica, I won't give names beyond that, has asked if there are other majors in addition to Pop Health and what those majors might be. So I think that as additional faculty come online, there can be additional majors. The Pop Health major is extraordinarily flexible. And so our current students include people who are, quite a few who are pre-med or pre-health. We've got people who are interested in global health and the law. We've got people who are interested in health entrepreneurship. We don't have, there are requirements for the major, but there are a lot of free electives. And so people can design a really flexible schedule that will meet almost any need as long as you have an interest in health. So I would say that maybe, I don't want to make too many predictions. I am sure that at some point there will be a health innovation and technology major, given the endowed professorship that we have that we'll be filling soon. Okay, so next question. Will there be a nutrition major or class based on nutrition? There will definitely be some work around nutrition. So my postdoctoral fellowship I did at Harvard working on the nurses health study, and the health professionals follow-up study was around nutritional epidemiology. It's a really important topic and area. Obviously nutrition plays an important role in health, and variation in nutrition across the population plays an important role in the health of the population. So it's an important factor. And when that type of thing comes online depends a little bit on when faculty with that type of expertise come into the college. So what does research look like in our environment needing social distancing? Research looks a lot like this. I spend a lot of time on Zoom, and it's not bad that we, by and large, don't have a large need for direct interpersonal interaction. We don't have right now a direct need for a lot of hands-on laboratory work. And so we can do most of what we do remotely or in collaboration remotely. And let's see, I've got a question here. Are there plans to combine pop health and engineering at Lehigh? Yeah, I mean, I think when you start talking about health innovation and technology and coming up with solutions for real world problems, problem solving is fundamentally kind of an engineering problem. And what that looks like in terms of, you know, traditional engineering curriculum versus a sort of a health focused pop health curriculum, you know, there are no, we have, so I've talked about the range of students we have. We have students who are, you know, planning to do what looks a lot like an engineering curriculum with 5 semesters of math and, you know, in physics and other engineering focused topics. And I don't see a reason, and I you know, I talk to engineers all the time about solving problems in my research. So the educational programs around that will happen. The easiest way to get it done is to think about customizing a curriculum within a pop health major, or looking at an engineering program that would allow for participating in the population health certificate or the global population health certificate. Let's see. As part of research, are there relationships with local and national governments so that policy suggestions that are part of the research projects are actually implemented? Yes. Well, let me say that understanding how policy gets implemented and how policy is happens is a big part of the research. So it's not so much just coming up with a policy that you think would work and presenting it to someone and hopefully it gets adopted. Although I do like the schoolhouse rock, like I'm just a bill, like how policy gets made. It's a favorite of mine. It was from a gentler time when politics was more like schoolhouse rock. But what Professor Gomez does is understand the dynamics of how policy happens and how it gets implemented. And that is a doorway to understanding how to make things happen. I'll mention also that Lehigh has this really incredible relationship with the United Nations. So Lehigh is unique in being designated as a university, as being designated as a non-governmental organization, an NGO for the UN. And we have these fantastic fellowships and interactions with the United Nations. And so if international politics and policy is of interest in health, that's another opportunity that exists university-wide, but certainly from the health perspective within the College of Health as well. So I'm happy to also answer. I don't have any other questions up here right now, but I feel like somebody might have one. Let's see, I didn't see the, oh, people just missed questions. Did I miss any? No. So answer that one, answer that one. Did I leave anything out? Did I excite anybody? Does anybody want to work on cancer with me, cancer epidemiology? Is there a plan to expand the offerings in epidemiology and communicable diseases? Yes, so we'll have, yeah, so it gets down to being, again, a sort of a person power issue. So right now there's, sort of card carrying epidemiologists would be me and Professor Choi. Professor Choi has got a new class coming out in the spring around environmental health, which is going to be a lot like epidemiology. I have the epi methods class I'm teaching in the spring. And it includes communicable diseases as a general epi methods class. We will have at least one more epi methods class. So we'll have methods 1 and 2. And then I will be developing, I'm sort of debating whether or not it's going to be a graduate level or at least an advanced undergraduate level seminar in causal inference methods. And you can bet, I can't say when, but you can bet that we'll have an infectious diseases epidemiology class. We'll have a chronic diseases epidemiology class. We might, break it down further into cancer epi, neurological epidemiology. That those things will exist in the near future, and it just kind of depends on who gets hired at what point. So I look forward to hearing from all of you who are interested in doing research. We are really excited about working with our students, and we will try and work with you at the pace that's going to make sense in these times. I think that it makes sense to be flexible and have reasonable expectations for that. And we can start talking about things now that might develop over a period of weeks or months or even years into something that would be a good capstone project for you, or thesis, or might end up being a career interest of yours. So get on the, I was going to say get on the telephones, but send an email, and we will respond and get your interest in it. If you're a prospective student, I encourage you to reach out and ask questions about the program. The feedback I've been getting so far from our students is very strong, and we're really excited about it. And again, as far as majors go, the major itself is incredibly useful, but it's also incredibly flexible, so you can really make it almost what you want. Is the College of Health inviting community attendees to the seminars by our faculty candidates? I don't see why not. This year or in this round of hiring, I'm not making a promise, but this has to be discussed. But I don't see why not. In this we won't. Whether or not people actually come to campus or not for interviews is a big question. And so when we have seminars, they will probably be done in this format remotely, or at least available remotely. And so, the ability to see people is important. The one exception to that may be if there is some confidentiality concern. So we'll have to see how that balance works out. But we try and be as open as possible with getting as much exposure as possible to faculty, potential faculty. Okay, I'm here. So Heather, I didn't want to leave you out of anything, and I also don't want to put you on the spot, but is there anything that you want to add?
Thanks, Hal. Not really. Like you said, there's a lot of opportunities for students to get involved. There's a lot of different things that the faculty are working on that is going to pique someone's interest, and it's going to grow. That's the exciting part. So yeah, that's great.
Thanks, Heather. And I look forward to getting an email from Norman. Okay, well, I will hang out here for a couple more minutes. I'm assuming that we've got everybody's questions covered, but in case someone comes up with more, oops, that's not what I meant to do. But I can stand here and talk and answer questions. So there will be an upcoming population health Jeopardy session. I believe that's right after this at 4 p.m. But someone can correct me if I'm wrong about that, because here's a secret about me and calendars. If I'm not looking at it with my eyeballs, I do not trust at all my memory of events. Actually, I can probably look at it right here. Yes, Population Health Jeopardy with Professor McAndrew and Gomez will be coming up at 4 p.m. our next session. And that is going to be way more fun than this was. So I appreciate you suffering through this when what you probably thought, this is what happened. I'm sure they thought that this was the Jeopardy one, and they joined it by mistake and had to listen to me talk about research, and Jeopardy is what they really wanted to do. So I thank you for putting up with me. All right, so there's the link to Jeopardy. You want to do, you can do whatever you do to get like sort of psyched up for competitions like that. It depends. I think sort of a generational thing. For me, it was kind of like Van Halen, and with the recent passing of Eddie Van Halen, so I listened to some Van Halen to get psyched up, although and get Eminem, Michael Scott, I think was doing it. So if you need to get prepped for Jeopardy. And but I think if we don't have any other questions, I will go ahead and give us 10 minutes of our time back to get ready for Jeopardy, and I will probably see you there. All right, so to my students, colleagues, future students who we look forward to seeing next year, and everybody else. Actually, while I've got you all, if you're a prospective student, I just want to say that starting now, but with next year, we will have a 4-1 accelerated BS and MPH program available. So you can come in, get your Bachelor's of Science in 4 years, and then in 1 more year, add a Master of Public Health degree to that. And so we're really excited about that. It's not on topic, but I want to let you know that that's coming. So if you are a prospective student, that's a unique opportunity. Or if you're a current student. So thank you all very much, and go have fun in Jeopardy.